You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to ASTRinstitute.com.
My name is Jeremy.
You
I'm
can
a
treat
student
your
physical
pain at
therapist.
home
About
and get
14 years
similar
ago, I broke
results
my feet
as what you
in a
just seen in
motorcycle
this video.
accident. My general
Simply
mobility
click the
on
link
my
on the
lower
screen
extremities is
to
just very
start our
limited.
home treatment program and begin
So,
your journey
how much
of
pain do you feel
healing,
there?
or
It's your
go
hand,
to
not much.
ASTRinstitute.com.
One on occasion.
Okay.
I just don't go into doing things that
Aggravated. Okay, so we want to do the motion that aggravated just to use it for testing. Can you do that now?
I can't recall a particular, but like just limited. So like if I try to touch my toes, I can get down there, but it's uncomfortable.
Okay, let's try that and we'll see how much discomfort.
So if I get here, it's like
More can you like slide your hands?
so like this is where I start to feel tension. Pain wise, it's probably a 1 or 2.
Where do you feel it?
All back through.
The hamstrings. Okay.
Mostly.
Back up. Any other motion?
This pain in the lower back,
How much?
1 or 2.
Side bend, left and right.
No pain. Sorry, bending.
Rotation.
I feel it, but it's not painful.
Okay. So when you felt it, you said you felt back in the scar tissue?
I feel it if I touch it or do hip.
Touch it. Can you do that for me?
Yeah. So if I go out here, I just feel a pinch back, kind of where that scar tissue is, and then also in the front.
In the front. You did a good job on it. It's not too bad. I'm gonna dig in, so let me know if it's too much. Feel that fibrosis there? His history actually helped me figure out where to start. Even though when we did assessment, there was a lot of positive signs, so I'm trying to save time and just get to see if this trigger all those tightness everywhere. Is that painful? It's okay.
No, it's fine.
And sometimes because you worked a lot in here, I might work in other areas because he did not work. You focus your work on the scar tissue,
Yeah.
not anywhere else.
No, not really.
Okay. So we'll know if that's actually what causing this discomfort and restricted range of motion. Have you ever been able to touch the floor?
Yeah.
Bend forward?
Yeah.
Let's see. I feel more fibrosis in the back, not in the surgical area. Can you feel this one? Yeah. Right by the sacrum area, actually.
In the sacrotuberous ligament, you could find some.
Mhm. You guys can see it after we finish. Is that okay with you?
Yeah.
You can see the fibrosis visually after using the tools, scar tissue. And sit up and try to bend forward. How's that?
A lot better.
Less pain?
Yeah.
Face the camera. Just listen to your body. If your body taking you further, go ahead. A little bit slower. Are you counting? If you're not counting, we're gonna do 200, okay? In front of the camera.
18. Yeah, it's 20.
Okay. Tell me how you feel. Any pain, discomfort, or back to normal?
I can get all the way down to here before I feel any, and it's down here.
In the hamstring, the back was fine.
The back feels great.
Okay. So let's lie on your sides. You feel it in both hamstring or one?
In both.
Both of them? Okay. So the same position. Your side. Yeah. Mm-hmm. You feel that? Here? Yeah. So let's do. I cannot do one in this side and see if there's a change. Might need to do the other side. Yeah, you feel this one? There you go. And your IT band.
Yeah.
You feel that?
Okay.
Yeah, okay. So he has a lot of scar tissue here, a lot of fibrosis, especially in the IT band. It's not too bad. I had a patient like really very hard. Like when you do this, you don't feel pliability in the muscle. You just feel like there's rock there. You will get that. But he's not too bad actually here. So we'll get him pain-free range of motion, just full range of motion. Is that too much or it's okay?
No, that's fine.
And I worked on this side that he injured originally just to, as a start, and we'll see how he responded to the treatment. Can we get him somewhere? Okay. And stand up. Get some measurement. Okay, you can see the camera, and it's go down and technical tightness, so it's gone.
Very little. I could be on the phone before I feel tightness.
We work on the injured side. Okay, we're going to talk about that in a little bit. So good. Thank you so much. Appreciate it.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to ASTR